Basically, a clinical psychologist is someone who is specialized in providing psychological assessments that contributes to either a diagnosis or contributes to further understanding of a person's psychological condition that then provides information as to how we might come out with a treatment program. So essentially, we're detectives. And by being detectives, also, we can better understand how an individual is. We can then contribute treatment as well. We are also trained in psychotherapy. It depends on which school or approach of psychotherapy. Usually it is cognitive behavior therapy. So we train in that to focus on more severe psychological problems. Not as severe as schizophrenia, but we do provide supportive therapy, lifestyle changes, behavioral changes to mental illness patients. And once the patients, I would prefer to call them clients, are more stable, they would then usually get continued support from the counselor because they're already functioning. And I would say how we are different from counselors and psychiatrists. The main difference, I would say, is the training in psychometric assessments. Not to say that psychiatrists and counselors don't do assessment, they do too. They've got their own kind of assessments. But when it comes to comprehensive assessments such as neuropsychological tests, normally the neuroclinical psychologist would do it, but we do comprehensive ones such as, the Wechsler Intelligence Scale for children, adult scale, IQ test basically, that we are able to read the whole profile to let you know what the person's strengths are and what the person may have some difficulties in. And from there, we provide further investigations as to how an individual is functioning or not functioning, and the results of the investigation contribute to diagnosis that's done by the psychiatrist. If you look at Malaysia, technically the only people who are allowed to do any diagnosis are psychiatrists, because psychiatrists are bound by the medical act, and clinical psychologists, we have an act now, but it is not enforceable yet. So if anyone were to do a diagnosis and they don't have any accountability to any act, that's a dangerous thing. So you need to think about legal implications. And the other bit that we tend to be more trained in is behavioral management, behavioral therapy. That is not really something that is part of counseling. Counseling will touch on that also, and same thing with psychiatrists, but it's more heavily focused in clinical psychology because we are more like, I guess you can say the coach, we're the taskmasters. Counselors are nice, fluffy people. Psychologists are the ones who are tough. We make you do the work. So we're not that nice, we're taskmasters. Those of you students in psychology who think, wow, clinical psychology, I want to go there, you want to think twice, because you probably end up doing tons of assessment, writing lots of reports, just like doing another thesis, but one thesis a day, which means you need to go through all kinds of literature review again and again, because when you write your report, you're going to make sure that you support whatever you write with updated literature. Otherwise, in case that report goes to court, lawyers are going to tear you apart. It's very scientist-practitioner. Whatever that we do, we assess or we treat, has to be backed up by updated literature. And what we do in the clinic also is to be able to provide our clients with options of treatment, and we need to be able to explain to our clients about these options, why we think these options are good, and what are some of the scientific evidence that shows that they are likely to work, and then help the client to make the decisions. It's always scientist practitioner, measurement, so that if you get better, we know. If you don't get better, also we know. It's a partnership in helping you get better, making sure that whatever that we do in our intervention or treatment actually improves your quality of life.